I think there are, or at least potential good parts, potential opportunities for credit unions. It's very important for them to understand all of healthcare reform so credit unions can better develop their own healthcare strategies going forward and make sure they're not missing any potential opportunities. For example, the development of exchanges, and it's not so much the public exchanges that are going into effect, it's more the private exchanges that I think create a potential opportunity for credit unions to change how they fund their healthcare plans, to make the cost more predictable year over year and to be able to better estimate it. And by that I mean the private exchange is where a health insurance company develops their own exchange and puts their plans side by side to each other, where an individual can buy one plan or buy up to a level that better suits them. So what the credit union can do is buy into that exchange, sponsor at the lowest level plan, but allow individuals to buy up. Therefore, year over year, they can set what their funding is going to be instead of tying the funding to a specific plan's performance. So it's a shift from a defined benefit approach to a defined contribution approach, much like what happened in the retirement arena years back. Same shift is happening now in healthcare reform, and the exchanges, specifically the private exchanges, make that a mechanism that is easier to put in place. They can decide not according to a plan's performance what they're going to contribute, but how much they're able to afford. They have to be careful and work with their consultant or broker on it to make sure that they still stay within what's deemed affordable care under healthcare reform, so they don't open themselves up to player-paid penalties potentially for not offering the right type of coverage or affordable coverage. Staying up to date with everything is the hardest part. There is a flurry of activity coming out of the government, quite frankly, right now. So following the Supreme Court decision as well as the elections, a lot of companies and credit unions are waiting to see what they were going to do to see, is this going to go away or is this going to change? Now we know it's going to stay in place for the most part. We'll see minor changes to it, but overall, healthcare reform's here to stay. But not only were employers waiting, the government was as well. There's a ton of areas that they had left for the government to provide clarification and details and samples and that sort of thing to help employers and credit unions get into compliance. Now, the government was also waiting to see what happened with the election. Now there's a flurry of activity, and we're seeing even deadlines being pushed back because there's just not enough time to get everything put in place. So staying on top of all of that information that's coming out is very difficult for any one HR department or any one person to do. So that's the toughest part right now. So credit unions need to rely on their carriers, their brokers, or consultants to make sure that they're well informed. Make sure that your credit union or your HR department specifically is staying on top of the changes. Make sure that they're aware of what the carrier is doing proactively on their part for their plans to make sure it's in compliance. There are DOL audits that are starting to take place now to see what steps employers are taking to get themselves into compliance. So the good news there is that most of these steps are being handled by, if you're fully insured, by your fully insured carrier. But it's not enough to sit back and assume that. You've got to go out and make sure that they have the documentation that that's being done. There are steps like notice requirements and summary benefit coverage distribution requirements that take some proactive steps by the credit union to do. And they got to make sure that they're documenting that they've done those and actually have followed through with providing them, just in case they ever are checked. One other thing that credit unions should be considering, we've got a lot of questions regarding, do I still need to offer health coverage going forward with the individual mandates staying in place? There's enough information now regarding the player-paid penalties that you can make an estimate as to what impact it would have. However, you can't stop the analysis on a dollars and cents comparison because, quite frankly, the penalty is almost always going to be less than the premium that you're paying or the contribution that the employer is paying for the coverage. However, you got to look at employer of choice strategies. If you stop offering coverage, or if a credit union stops offering healthcare coverage, and your competitor for competition, or I should say for talent down the road, keeps offering it, you probably will lose out to your competition as an individual says, well, I don't want to go to the public exchange, which is going to be bare bones, 4 choices of plans that you can go to. I'd rather go to this competitor of yours for talent to help me with better coverage, a better experience buying that coverage. So you have to look at not just dollars and cents, but what does it mean to your ability to attract and retain talent if you were to drop that coverage.